Hello, my name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the Massachusetts General Hospital Frontal-Temporal Disorders Unit. And I'm thrilled to be here tonight and present to you the fourth module of our Care Plan Trifecta webinar series. The Care Plan Trifecta, person-centered care planning for every stage of life with FTD. The Massachusetts General Hospital Frontal Temporal Disorders Unit, or the MGH FTD Unit, as we like to call it, is a clinical research program focused on FTD, atypical and young onset and rare forms of Alzheimer's disease and related dementias. Our team is led by Dr. Brad Dickerson, and we're committed to providing the highest quality of care while we work tirelessly for a cure for these devastating conditions. Our Care Plan Trifecta webinar series is a part of our overall caregiver support program, our community education work. Here is where we're talking to you about person-centered care planning, first steps after a diagnosis, how the Care Plan Trifecta works for your family. That's one of the things that we like the most about this model. It's that you can personalize it for your values, your culture, and your goals of care. And then at the end, I'll have a wonderful discussion with Amy Almeida, our manager of caregiver support services. So I want you to think about the Care Plan Trifecta as a framework to help you develop a person-centered care plan that focuses on the person that you're caring for, you, and your community. You know, the you part is so important. We are talking so much about care for the caregiver lately. The Care Plan Trifecta can help you unify healthcare with personal values and goals of care. So this graphic is really meant to help you to think about yourself. You know, if you're an individual living with a diagnosis, yourself and your loved one, if you have a care partner, if you're a caregiver and the person that you're caring for might be more advanced along their diagnosis journey, think of yourself at the center and that these pillars are connecting you for your care plan. The first is the medical community. The second is the home community. And the third is the patient advocacy community. Now, just as a review, because this is the fourth installment of our four-part series. So you can go to our YouTube channel. If you go to YouTube and put in MGH FTD Unit, you can watch the first three modules. And the very first one that we talked about was connecting with the medical community. This is going to be the start of any care plan journey because you need to understand what is the medical condition? What's going on that's creating these symptoms, changes in functioning, or new challenges in life? We encourage everyone to get an expert diagnosis because that's what is going to help you understand your changes, your condition the most. That's what's going to connect you with the appropriate treatment and research opportunities. And that's what's going to help you become connected to the best team members. And we review at length in the first module, how can you help to connect all the healthcare providers on your team so you make sure everybody understands all the health conditions you have and all of your care planning is pointed towards your own individual treatment and treatment wishes, values, and goals of care. Another review is the home community. This is so big and important to us that we did two modules about it, which is really wonderful. But this is because all care doesn't happen in the clinic. And we respect that when you leave our clinic space with your diagnosis, you then have to plan your life with this diagnosis in mind. We encourage all families to connect with a trusted attorney. If you're living with Alzheimer's, FTD, or another condition that causes dementia, we want you to connect with an elder law attorney, no matter what age you are. We want you to connect with local resources. And we want you to connect with your family, your friends, your community for love and support. So please go check out modules 2 and 3 again on our MGH FTD Unit YouTube channel to learn more, if you missed it, about the medical and home community. But today we want to focus on the third pillar, and that's the patient advocacy community. What do you get when you're connected with the patient advocacy community? We think a lot about education, connection, and the community itself. Education starts with something that many of you have heard me say, and that's I want you to avoid the midnight Google. What is the midnight Google? What does that mean? That's when you're up late, you might be feeling anxious or stressed, you're worried, and you open up your laptop or your phone and you type this diagnosis or some symptoms into Google, and then anything could pop up. You could have information that would come up from an unverified source. It could be from people that haven't been trained in the condition that you or your loved one are living with. So, when you connect with the right patient advocacy organization for your specific diagnosis, it can be a wonderful source for education and information that you can trust. That can help you to be better informed as a person living with a diagnosis or as a care partner. And it can even help to reduce some of your anxiety and stress because you're not listening to all these things that may or may not happen. You're really trying to focus as much as possible on your particular diagnosis and what is relevant for you. Connection, which is, of course, our favorite part of the patient advocacy community, is that you can meet others walking this journey. This is where you can attend support groups and you can get real help and practical advice for the journey. And then community, that's your opportunity to participate in social events, community gatherings. Sometimes Amy and I call them friend raisers when you just want to get people together. And all of these things are incredibly important because having social connections and reducing isolation matters when we think about quality of life. We do not yet have a cure for dementia, but we do have a cure for the isolation and loneliness that may come with a diagnosis. I cannot say this enough. I say it in almost every presentation that I make. I say it to new caregivers. I say it to caregivers who have been feeling that isolation, that this is something that we can fix. We know how to fix this. And it starts with this pillar, the patient advocacy community, becoming connected so that you can get the skills, the care, and the support that you need wherever you are on your diagnosis journey. So, what do you need to do first? The first thing that you need to do is you need to connect with the right patient advocacy organization for you. So, let's say that you have a diagnosis of Alzheimer's disease. The Alzheimer's Association is probably a great fit for you. One of the things that's wonderful about them is their full title is the Alzheimer's and Related Dementias Organization, but that would be a little bit too long. So actually, if you're living with any form of dementia, you are able to reach out to the Alzheimer's Association. You can call their helpline, which is open 24/7 every single day of the year because Alzheimer's and dementia never take a day off, so they don't either. And that could be a wonderful fit for you. But let's say that you have a diagnosis of Alzheimer's disease, but in fact, it's a young onset Alzheimer's. And that's where you might want to connect with Lorenzo's House, which is an organization specifically designed at focusing on dementia justice for all and supporting families who are walking the young onset journey. Of course, being the MGH FTD unit, we refer many families to the Association for FTD. And I think that this is just a small handful of the organizations available to support caregivers and families walking the journey of life lived alongside dementia. But I want you to know that it can matter connecting with the right organization. So if you're with an organization and you're like, I'm not really meeting people that I feel like are having a similar experience, maybe you need to switch over. And then also remember organizations like the Rosalind Carter Institute for Caregivers and AARP, the Family Caregiver Alliance, they have wonderful resources for all types of caregivers. We just had to give a shout out again because we are the MGH FTD unit and we care for so many people living with frontal temporal disorders. We work closely with the Association for Frontal Temporal Degeneration. This slide is a beautiful example of the range of services and supports that can be offered by a patient advocacy organization. And it's so exciting that AFTD puts right at the top that one of the areas that they work to promote is research. Did you know that oftentimes by being connected with your patient advocacy organization, the right one for your diagnosis, it can help to lead you to opportunities for research that are the right fit for you. Um, and so you might hear about cutting edge research for the disease. You might have the opportunity to enroll in a study. You may be asked if you're interested in enrolling in a patient registry. It's just a way to make these opportunities easier because we know that when you're a caregiver, when you're a person living with a diagnosis, you have a lot on your plate. And so we want to streamline the supports, services, education, and information that you need so that it's as easy as possible to access. Awareness, we're going to talk about more support, education, and advocacy. And look, there's a QR code here you can scan. That's going to be one of our tips to sign up to be connected and get regular communications from your patient advocacy organization. I love this picture. This is my son Noah and I. We were manning an educational booth at a brain health fair some years ago. But think about the educational opportunities available through your patient advocacy organization. And so we wanted to give you some action items that could feel a little bit easy, starting with signing up. So if you have Lewy body dementia and you go to the Lewy Body Dementia Association website, just as if you go to AFTD or the Alzheimer's Association websites, there's the opportunity to sign up to receive emails, newsletters, be on their mailing list, follow them on social media. I encourage you to do all of these things. And in fact, it can be like the first easy step to connect with a new organization. We know it can be overwhelming and it can be hard to do everything all at once. But just by signing up for an email, you might then have something that comes direct to your phone, direct to your laptop, that you could say, oh, this event, this webinar, this support group would be a good fit for me. And you didn't have to look too hard for it. It came right to you. Next, we want to encourage you to attend online and in-person educational opportunities. If you're here right now, you're doing a great job because you're already doing it. Many organizations offer online webinars, live streams, Facebook opportunities to join in. They'll post videos on their YouTube or other social media channels. And then some organizations will have whole educational conferences that take place online, and many are still doing in-person events. This can be a way you can attend, you can take in information, you can learn, and you can choose how much you interact with other attendees, how much you speak up, whether or not you ask questions. So there are opportunities to be fully engaged and opportunities where you can say, I just am ready to be a listener right now. And I think something that is critically important is to spread the word, share information. So, not only facts that you may learn, like about Alzheimer's or FTD or another condition, but maybe spread information like, hey, I went to that education day offered by the Alzheimer's Association, and it was wonderful. The people were so nice, and the lunch was free, and I actually learned a few things and I left feeling less alone. So I think that the more you can share information with the people who are surrounding you and your loved one, the better educated they'll be and more able to support you on your journey. If you're looking for a trusted source of education and information about frontal temporal disorders, I encourage you, please listen, like, and follow our From Care to Cure podcast. And there are many podcasts offered by other patient advocacy organizations and clinical research programs. So do a little bit of online research. Check out on Spotify and Apple Podcasts, what other academic medical programs, trusted organizations, advocacy organizations that have podcasts and other educational opportunities that you can trust. And it might be a little bit interesting and fun. Support groups. This is actually a picture of myself, co-facilitator John Kearney, and co-facilitator Amy Almeida from the Boston area FTD support group in 2019, which is when I realized I've been going to support group for a decade. At that time, all our support groups were in person. And now we've been, for about 5 years, having support groups online. And you know what? We found that people have developed real relationships, learned skills, tips, tricks, supported each other just as much online as they have in person. So think about a support group. What would fit best for your life? Are you still working full time? Do you need an evening support group? Are you someone who really likes the experience of getting out of the house and going to your community center or local hospital to be at a support group in person? Do you want to join online because your loved one needs supervision and maybe they could be sitting happily engaged in an activity in one room and you can be just one room over and on your support group? So think about timing and location. The right fit. There are actually many types of support groups that you can join. You can join a support group for people living with a diagnosis. You can join a support group for care partners only. You can join support groups where the person with the diagnosis and their care partner go together, spouse support groups, adult child. There are all types. And there are even support groups that focus on stage, so maybe newly diagnosed or those at the end of their journey. There are support groups that last for 6 or 12 weeks. And then there are support groups like ours that are open and just run every week. And we actually don't have any endpoint in mind. Um, and when you think about the structure of the group, think about that. Like, what would be better for you? Are you someone that, okay, I can commit for 6 weeks and I'm going to just see how it goes? Or do you like the idea of a drop-in group where you're welcome to come when you need support the most? What kind of leadership do you want? Do you want to make sure that it's led by a professional staff person, maybe a social worker at a hospital? That might even be the type of support group where they might bill your insurance for that time. Or do you want to go to a community support group run by volunteers or peer facilitated by other people who have walked the journey and they've probably had training, but also are bringing their lived experience to how they're guiding others. So that probably feels overwhelming. But I would say that if you go to support group and you don't really love it, go to a different support group because there's a lot of opportunity out there. Raising awareness, funds, and hope that the cure of tomorrow is not so far from the care of today. I think this is where we want to pause and talk about advocacy. Advocacy is something that is a big part of patient advocacy organizations. And you think, well, what even is advocacy? How are we defining this? And I know that for myself, you'll see me there kind of in the front. Advocacy is something where I thought of only as big groups of people. Everyone has to get together and we're storming the steps of Capitol Hill and we have this shared mission to turn people's hearts and minds to our issue, sharing our stories. And really, the point of advocacy is to turn the tide for public policy, social initiatives. And really, it's this idea of wanting to make life and community better for all citizens. But the thing is, advocacy really starts with you as an individual. And what many caregivers, especially caregivers of loved ones living with cognitive impairment or dementia, find is that they are learning advocacy skills just by matter of course. And whether you wanted to or not, you're becoming an advocate. So let's say you're a person with a diagnosis and you actually speak up to your primary care physician. You say, I'm noticing changes in my memory and thinking. I'm making mistakes at work. You are speaking up for yourself. That's self-advocacy. You're a caregiver. You're asking a family member or a friend, hey, can you stay with my loved one? Because I actually need to take care of myself and attend my annual well visit. I need to get that colonoscopy or that mammogram. That's you advocating for yourself. And then I have had the opportunity while working in clinic to see clinicians who are advocating on behalf of their patients, calling insurance companies, making sure that people get the scans that they need or the prescriptions at the price that they can afford. So, advocacy is something that starts with the individual, but it has the opportunity to grow bigger. If you are impacted by Alzheimer's disease, I encourage you to check out AIM, which is the Alzheimer's Impact Movement. It's so incredible. I've been able to participate in the National Alzheimer's Forum. I've actually attended as an FTD advocate. So, just so you know, the Alzheimer's Association really takes it seriously when they're talking about supporting all dementias. But the AIM as an organization does an incredible job of educating individuals who've been impacted by Alzheimer's and related dementias on how to share their stories so that we can move policy forward. So I mentioned before raising awareness, funds, and hope. Sometimes when we're on Capitol Hill, we're advocating for more money to be spent on Alzheimer's and related dementia research, care, and services. And having these voices from community members, voters, people who are living the journey, walking the walk. This is what really gets the attention of elected officials and policymakers. And I love that it isn't a red or blue issue, it's a purple issue. The Association for Frontotemporal Degeneration is also doing some advocacy work. And here we see celebrity advocate Emma Hemming Willis. It is incredible when celebrities step forward to raise their voice because they can amplify an issue. But you don't need to be a celebrity to be an advocate. You just have to be willing to share your experience and talk about what matters to you and what changes would make your life better. Sometimes people are not able to go out and participate in advocacy efforts. It might not be what they want to do. It might be too hard to fly to DC or go to their local state capital. But there are other ways to be an advocate. I think that all of us who are in the greater dementia space, we are hoping for a tomorrow where there are disease modifying treatments, the opportunity to prevent and, of course, cure Alzheimer's and related dementia. And so, a way to be an advocate is to participate in research. You could do that by volunteering for a study. That is an act of advocacy to show up and be a part of learning about these conditions. You might be on a research advisory board. So, right now, if you're a research participant in a study, next time you go in for a research appointment, say, hey, do you guys have a research advisory board or a participant engagement council that I could volunteer on? And that's where you can speak up about your experience in the research study and maybe improve things in it. What if your whole journey of caregiving was just very busy and you didn't have time to participate in research? But at the end of your life, you're interested in being a brain donor. That's actually a way to make an incredible impact for research, and it is a way to speak even beyond your life. Um, Being able to give to the future treatment and cures is absolutely being an advocate for a better tomorrow. And I want everyone to know that it is just as important as showing up on Capitol Hill to speak with an elected official. There's also opportunities for fundraising because oftentimes to advance science, people need funds. And those opportunities exist with every single patient advocacy organization. You could decide that maybe for your birthday this year, instead of getting presents, you're asking people to make a donation to the Alzheimer's Association. Or maybe you're part of a group and you want to plan a big swanky gala to benefit a scientist or a clinical research program that's meaningful to you. This is not required, but for some people, this is the way that feels good to them to speak out, give back, and fight against the disease. And so, just so you know, you can always reach out and ask your patient advocacy organization if they need help in this area. So, what are the takeaways from the patient advocacy pillar? That it's very important that you have a trusted source for education and information. It's critical that you find ways to connect with other people in your community. You may even find that you make new friends, that you get support that you never expected, that they can create new moments of joy and hope along your journey. And then I want you all to consider how powerful you are. When you are having a lived experience of life with a diagnosis and you speak to someone who's a potential funder, who's a potential policymaker, who's an elected official, hearing that you are actually living this journey and you may even connect with them, maybe they had lived experience, it's incredibly meaningful. So consider it. Again, I want to thank everyone in the MGH FTD unit for supporting us. We have deep gratitude for every person who's living with a diagnosis, our care partners and families who've been impacted, those who donate and support our program. You are all the inspiration that is helping us move forward to make sure that we are providing the highest quality of care while working tirelessly for a cure. So now I'd like to welcome Amy Almeida, our amazing manager of Caregiver Support Services.
There we go. Katie, one thing that has struck me over the course of these four webinars in the Care Plan Trifecta is just how much there is to do when you're a person living with a diagnosis or a care partner.
Yes,
And it really feels like, wow, all these resources may be great, but it seems like more homework for me.
yes. And I think that what we don't want our families to feel like they have to do everything all at once. But it is important that they know what might be coming ahead. And in fact, we really try to highlight, okay, if you're feeling very overwhelmed, what's the one thing that you should do for each pillar? So when we're talking about the medical home, the thing that you need to focus on there is making sure that you have an accurate diagnosis and that you're identifying who's my expert medical provider. Okay. When we think of the home community, we really encourage people, you need to meet with an attorney. And if you have a diagnosis that leads to dementia, it needs to be an elder law attorney. So that's that one thing. And then I would say for patient advocacy, if I was going to ask you to do one thing, go on the website for the patient advocacy organization for your diagnosis and just sign up to be on the email list. And sometimes it's just that. You could be on the email list for a year before you decide to attend a webinar. And it might be 2 years before you say you're ready for a support group. Other people want to come to support group a week after they get a diagnosis. And that's just personality.
Right. Yeah. And, I think I know in my experience that my mom was diagnosed in June. At the time, I had a very rigorous job. I didn't get to go to support group until September.
Yeah.
And at the time, my mom was still living on her own by herself. She was a widow. I didn't feel like I needed support, but I needed to know what was coming. And I thought, okay, if I go to this support group, there'll be people who are ahead of me on the journey, and I'm going to learn hopefully what I need to know. But if not, at least I'll know what I should be looking out for.
And it's so interesting because if you think about it, Amy, that's actually really brave. Like you were very brave to say, okay, this is my reality now, but I'm okay with going to this group where people might be at different stages and thinking about what's ahead. We've had caregivers share with us that that has been really difficult for them. And so I think maybe talking a little bit about what are the things that are scary about being in a support group.
Yeah, we hear a lot of times caregivers say, I don't need support. Sometimes I'm not a caregiver. Other times, I don't want to talk about feelings. I don't want to
Right,
be in a group of people talking about their feelings.
right.
And, we say, you don't have to talk about feelings. You can just sit and listen. There
Yes,
may become a day when you do talk about feelings,
yes.
but
But no
by
one's
that
forcing
point,
you.
no one's forcing you. And by the point that you may get to when you talk about your feelings, you will be in a community who knows you and values you and you trust.
Yes, yes. That's actually a great point too. Thinking about the community of your support group. And I look back and I realized that the very first support group that I attended actually made a little bit of a mistake because I went to a support group through the Alzheimer's Association. But at the time, I was caregiving for my husband who was very young, living with a young onset dementia. And I found that there were people who were 20, 30, 40 years older than I was at group. And they just kind of looked at me with pity. And I just felt like I wasn't a member of the group. I was this outlier. And I felt awkward, and everyone was looking at me. Like my shoulders are going up, remembering the group now. But when I started going to the FTD support group, I was one of the gang. And suddenly I could actually learn and talk about specific challenges because people looked at me as, yeah, we get it. And you're part of the group.
Yeah, and in our support group, we, some of the more experienced members, like to give a special welcome to the new people, saying, we're sorry you have FTD in your life, but we're so happy you found us and you are now part of, our community here.
Yeah.
And, I like to tell caregivers if you go to a support group, just like you did, Katie, and things aren't clicking, look around. There's probably a support group that you may click with.
Yes.
I know the AFTD has such a wide variety of, specialty groups. This month they're launching one for Spanish speakers. They
Oh,
have groups for husbands. They have groups for um, parents who have kids in the home while being a care partner to their spouse. And they have LGBTQI plus support groups as well. So find one that fits your situation. And again, the Alzheimer's Association has very similar groups for adult children, for spouses. So just be on the lookout.
so thinking about the caregiver feels overwhelmed and they're like, man, I would love to be in a support group just with wives, just with adult children. I would say if you can't easily find it on the website, you're feeling stressed, send an email to the general info box at the patient advocacy organization telling them what you're looking for. Someone will get back to you, or pick up the phone and call their helpline and tell them what you need. That's the job of the patient advocacy organization to pair you with the right fit. So, ask them to help you while you're looking for these resources as well.
And I was just, did you want to say something about support groups? Because I was actually going to say something about advocacy, but we can talk more about support groups if you'd like.
Oh, well, I want to talk about advocacy, so go ahead, and then I think we'll have the same thought.
Well, one of the things, Katie, that you didn't mention about advocacy is that many of these patient advocacy groups have advocacy pages, and you don't even have to leave the comfort of your home, of your couch. You can send an email to your elected official straight from their website. They will have sort of a pre-told story. You can adapt that to your situation for whatever policy efforts that they are advocating for at a given time. I've done this so many times and it is so easy, and you feel like, wow, I just did a great thing and it only took me a few minutes.
That's wonderful. Yes. And I think that that just also speaks to that the organizations understand that caregivers and families need different ways to communicate. I love that. I was going to say, and I think you really spoke to it when you just said that you felt like, wow, I did something. I actually, every time I've been on at an advocacy event or been part of a community walk, and have seen hundreds or more than 1,000 people in one space, all focused on changing the thing that has hurt my family. Every time it has infused me with hope and made me feel like I'm not alone. I'm not the only one who wants to fight this disease. And it has helped me so much to get over the grief that I've felt from having loved ones lost and impacted by these diagnoses. And I don't think that that's really talked about enough, that you have the potential to leave with this feeling of hope and inspiration, like belief that the future will be different.
Yeah, I mean, I always think that action is the antidote to just despair, right? The despair and the grief that can come with these diseases. And by advocating, whether or not that is with your elected officials, whether or not that is, with the medical professionals in your loved one's life, or on behalf of your family alone. It really can, actually, I was going to say, with respect to research, participating in research, that can really give you a feeling of power over these diseases when often the second you hear the diagnosis, you feel quite powerless.
Yeah. So I think that after thinking about the care plan trifecta, this whole series, and what are we asking people to do, right? We reviewed what's the most important thing in each module, but to really think about in the patient advocacy space, how this could be a place for you as the caregiver, for you as the person living with the diagnosis, that you would get something. You'd get information, you'd get support, you'd get hope. So, please don't forget this pillar when you're making your person-centered care plan, because it's actually just as important as all the others.
And I think with respect to support for the caregiver, especially, it's the most important.
I think so. Yeah.
Well, I think on that note, and I guess related to advocacy, we're filming this in on September 16th, and starting on Sunday is World FTD Awareness Week. And just want to thank all the incredible advocates across the United States who have gone to their state houses and advocated for recognition of FTD awareness in their states, in their municipalities. Here in Massachusetts, where the both chambers of the State House have passed a resolution recognizing it, and we're awaiting word from a proclamation from Governor Healy as well. So congratulations to the advocates, and keep on advocating.
Keep on keeping on.
Well, thank you all for participating in our Care Plan Trifecta webinar series. We'll have all four modules posted on our YouTube channel. And check in every once in a while on ftdboston.org, our website. If you click under the news tab, you'll get to read about um, news all about FTD and about the folks here in our MGH FTD unit, including the most recent, or actually, I'm not sure if it's posted yet, a magazine article that tells Katie's story with a very interesting twist. So hopefully that will lead you to our website. And thank you for participating.
Thank you,
Have a good day.
Amy. And thank you, everyone.
Thanks, Katie.